So today we are going to learn something about the probe handling. This is the linear probe, and then we will also use the curvilinear probe to demonstrate to you different movements of the probe. So we have my clinical assistant here. Asif is here. Thanks to Asif. So now I'm going to place my probe transversely over the forearm or the wrist, you can say. Now let me show you what is sliding, what is tilting, what is rotation, and what is rocking, right? So now this movement of the probe is known as sliding. Simply, I am sliding. By sliding, what will you get? Let me show you. I will keep sliding my probe back and forth, and you will see the change of the image. The whole image will be changed on the screen by sliding it like this. So this is what I'm doing. I'm sliding it. I'm sliding. So you can see the change in the structures because I am sliding my probe from one position to the another, a new position, so the whole image will change. Now this is sliding. Now let me show you what is rotation. I am keeping my probe in the transverse axis, or you can say I have placed my probe transversely. Now let me show you the rotation. Rotation means this. I have rotated my probe from transverse to the longitudinal axis. Transverse to the longitudinal axis. Let me show you these movements of the probe on the screen. I will change the position of the probe from the transverse to the longitudinal, and just look at the structures and you will be able to see the tendons and the nerve in a longitudinal direction. Now I am slightly rotating my probe. Now it's in longitudinal direction. The previous image was showing the cross section of different structures like these tendons over here and the nerve on the top. Now keep looking at the nerve and the tendons. I'm rotating my probe from transverse to longitudinal, and now you can also appreciate the nerve and the tendons in their longitudinal length. You can see the whole length of the nerve and muscles. Again, I am rotating my probe from longitudinal to the transverse. Now you can see the cross-sectional image of the structures. Let me show you what is tilting. Keeping the probe on the same place where we are not actually moving the probe. We are just giving a little angulation to its placement. Is known as tilting. And we are doing this movement perpendicular to the direction of the beam of the probe. Now the direction of the beam is like this, transverse, right? We are tilting it perpendicular to the transverse axis. See, so this is tilting. The direction of the beam of the linear probe is transverse in the transverse axis. Can you see? Is in the transverse axis. Now we are moving it perpendicular to the transverse axis, keeping the probe in the same place. This is tilting. We do this to have a clear image of the structure we are aiming at. Let me show you. Now let's say we are looking for the median nerve, and you can see the median nerve is here on the top. Now you have to differentiate it from the other structures so you can tilt the probe. Now let me show you again what I am doing. I am tilting my probe. I am not moving my probe from its original place. I'm just keeping the probe there, and I'm just giving it a little angle back and forth, anterior posterior. So now you can see what's happening. You can see the change of structure, the echogenicity of the structures lying just beneath the median nerve. So the change of echogenicity of the structures can help you differentiate one structure from the other. Let me show you what is rocking. We keep the probe on the one place and we just rock it back and forth like this. Now what we are doing, actually this movement is performed parallel to the beam of the probe. Now this is the transverse axis of the beam, right? So I'm keeping it here, and I am rocking it, moving. So the direction of the movement or angulation I'm giving to the probe is actually parallel to the beam of the probe. Both are parallel, so this movement is known as rocking. Okay, now let me show you what is the inline approach of needling and what is the out of plane needling technique. So while keeping my probe in the transverse direction, in the transverse axis, now when I'm coming from one side like this over here, from this side, so it means this is in plane. Why it is in plane? Because let me show you why it's in plane. What I'm doing here is I am passing my needle, advancing my needle in the plane of the beam, so you will be able to see the whole length of the needle, right? So this is the in plane technique. This is the in plane. Now what is out of plane? Out of plane means you are going like this, out of plane. Now what does it mean by out of plane? Now let me show you. Out of plane means, so this is the plane of the beam of your probe. Now you just a tip of the part of the needle will be under the beam, not the whole length of your needle will be under the beam. So this is out of plane technique, like this. So while using this technique, you will be able to see the just part of the needle, sometimes the tip and sometimes the part of the shaft under that is passing under your probe, not the whole length of the needle. So it appears as a dot. On the screen. So that is in plane and out of plane techniques.